This is Festus Enikai. In today's video, we'll be discussing hypertensive disorder of pregnancy or high blood pressure in pregnancy or hypertension during pregnancy. Please don't forget to subscribe to my YouTube channel and follow me on all my social media. In today's video, we are to follow this outline. We'll look at the meaning of hypertension. We'll look at the classification of hypertension during pregnancy. We'll look at gestational hypertension. We'll look at the difference between gestational hypertension and pre-eclampsia. We'll look at risk factors for gestational hypertension. We'll look at the pharmacological treatment of gestational hypertension. Let's get started. Hypertension in pregnancy. Before we discuss hypertension in pregnancy, let's quickly look at the definition or the meaning of hypertension. What is hypertension? Hypertension is the persistent elevation of arterial blood pressure. Hypertension is the persistent elevation of arterial blood pressure, diastolic and or systolic, greater or equal to 140/90 millimeter of mercury in an adult of 18 years or above. Hypertension is one of the most common medical problems encountered during pregnancy, complicating up to 8 to 10% of pregnancies. Classification of hypertensive disorder during pregnancy. Classification of hypertensive disorder during pregnancy. Hypertensive disorders during pregnancy are broadly classified into 5 categories. Hypertensive disorders during pregnancy are broadly classified into 5 categories. 1. Chronic hypertension. 2. Gestational hypertension. 3. Pre-eclampsia. 4. Eclampsia. 5. Pre-eclampsia superimposed on chronic hypertension. In today's video, our focus will be on gestational hypertension. Gestational hypertension. Gestational hypertension. This is the type of hypertension that occurs in pregnancy after 20 weeks of gestation without the presence of proteinuria. That is, there is a persistent elevation of blood pressure after 20 weeks of gestation without the presence of protein in the urine. Types of gestational hypertension. Based on the time of cessation after delivery, postpartum, it is classified into transient gestational hypertension. Blood pressure returns to normal before 12 weeks of postpartum. Chronic gestational hypertension. Blood pressure persists after 12 weeks of postpartum. The difference between gestational hypertension and pre-eclampsia. The difference between gestational hypertension and pre-eclampsia. Hypertension in pregnancy. This diagram explains the difference between the various types of hypertensive disorders during pregnancy. An hypertensive disorder that occurs after 20 weeks of gestation can either be pre-eclampsia, eclampsia, or gestational hypertension. If it occurs after 20 weeks of gestation without the presence of proteinuria, it is referred to as gestational hypertension. If it occurs after 20 weeks of gestation with the presence of proteinuria, it is referred to as pre-eclampsia. Pre-eclampsia that occurs simultaneously with seizures is referred to as eclampsia. An hypertensive disorder that occurs before 20 weeks of gestation can either be chronic hypertension or pre-eclampsia superimposed on chronic hypertension. If it occurs after 20 weeks of gestation without the presence of proteinuria, it is referred to as chronic hypertension. If it occurs before 20 weeks of gestation with the presence of new proteinuria or increased proteinuria, it is referred to as pre-eclampsia superimposed on chronic hypertension. The CH here referred to as chronic hypertension. Risk factors for gestational hypertension. Risk factors for gestational hypertension. 1. Being premigravid, that is first time pregnancy. 2. Hypertension in previous pregnancy. 3. Being younger than 20 years of age or older than 40 years of age. Being black. Multiple pregnancy, that is twin, triplets, as the case may be. Family history of gestational hypertension. Medical conditions such as CKD, chronic kidney disease, or DM, diabetes mellitus. BMI greater or equal to 35. Body mass index greater or equal to 35. That is severe obesity. Pharmacological management of gestational hypertension. Pharmacological management of gestational hypertension. The most commonly used drugs. The following are the most commonly used drugs. 1. Nifedipine. 2. Metidopa. 3. Labetalol. Then 4. Hydralazine. We have nifedipine, we have metidopa, we have labetalol, and we have hydralazine. Now, let's talk about each briefly. Nifedipine class, calcium channel blocker. Subclass, dihydropyridine. FDA pregnancy category. C. Available form, oral, capsule, not common in Nigeria. Tablets, 50 mg, 60 mg, and 90 mg. 60 and 30 mg are also available in extended release form. They are also available in extended released form. Now, let's talk briefly about metidopa. Metidopa class, alpha-2 receptor agonist. Class, alpha-2 receptor agonist. Available form, injectable solution, 50 mg per ml. Tablets, 250 mg is available. 500 mg is also available. FDA pregnancy category B. However, some literature will tell you A. FDA pregnancy category B. Now let's talk briefly about hydralazine. Hydralazine. Hydralazine belongs to the class vasodilator. Available form injectable solution 20 milligram per ml. Injectable solution 20 milligram per ml. Tablets 10 milligram is available, 20 milligram is available, and 50 milligram is available. Lastly, let's quickly talk about Laalalaw. Laalalaw is a mixed blocker, a combined alpha and beta adrenoceptor blocking agent, an alpha 1 blocker, and a non-selective beta antagonist. Available form injectable solution 5 milligram per ml. Tablet 100 milligram is available, 200 milligram is available, and 300 milligram is available. Note: IV Laalalaw is used for severe hypertension. Note: IV Laalalaw is used for severe hypertension. Laalalaw is contraindicated in asthmatic patients. Take notes, especially the pharmacy students. Take note of this, it is very, very important. Laalalaw is contraindicated in asthmatic patients. Why? Why is it contraindicated in asthmatic patients? Because it is a non-selective beta blocker. Because it is a non-selective beta blocker. FDA category C. FDA category C. And don't forget, health is wealth. Your wealth depends on your health. Health is a personal responsibility. You are responsible for your health. What the doctors, nurses, pharmacists, and other healthcare providers say is important, but your actions are superior. Take the right actions today and stay healthy. Thank you.